I think if we have to take a step back, I understand how frustrated people are. I understand the anxiety. I understand that people want to get back to normal living. And our focus has to be on ending the pandemic. And as it pertains to what we've seen at Coots, what we're seeing at the Ambassador Bridge, what we're seeing here in Ottawa, our approach has been to support the municipalities, to support the provinces, to provide RCMP support when requested. We've done so multiple times at many jurisdictions. And to your point, Evan, Canadians have the right to protest, but there's no right to blockade, and this is now affecting critical infrastructure. It's affecting industrial plants. It's affecting the food supply. And so our job as a federal government is to make sure that we support the provinces, the municipalities, provide the police support that is needed so we can get this job done.
Okay. I mean, everybody's saying it's a jurisdiction and we're going to support. Meantime, you've got hundreds of millions of dollars being lost economically. Protests that have gone on for weeks. Look, the protesters, the provinces, some of your opposition say, why doesn't your government give a plan as to when you're going to ease back some of the vaccine mandates? This is not given into the mob, as some have characterized it. Quebec has just done it, Alberta, Saskatchewan. They're saying we're 85, almost 90% vaccinated. It is time to roll back and take some steam out of this. I will ask you a question that one of your MPs who's critical of your own government, Joel Lightbound, said. And he said, what is the epidemiological data to show that forcing truckers to get vaccines in any way, shape, or form is helping to stop the spread of Omicron? Do you have any data to show? Because that was the spark here.
Well, I think we can get beyond the spark, Evan, because both sides of the border imposed that vaccine mandate, and I can tell you that the organization responsible for cross-border trucker was very clear that that mandate did not have any material effect on cross-border traffic. But let's talk about what's happening now at Coots here in Ottawa and at the bridge. These are illegal protests. Canadians expect the rule of law to be upheld, and I can tell you that there's progress being made. If you take a look at my own province of Alberta at the Coots border, we're down from 250 vehicles now to 40. We are making progress. I've seen some progress take place here in Ottawa as well, and we're making sure that we are in lockstep with the provincial jurisdiction and also the Windsor authorities at the bridge.
Yeah, Mr. Boissonnault, I'm just reality check. Maybe that's incremental progress to you, but most Canadians see day 3 at the Ambassador Bridge shut down, 2 weeks in Ottawa, the parliamentary precinct essentially being what the mayor calls occupied, and goods not flowing. I don't know if anybody's calling that. I mean, maybe there's incremental progress, but I don't know if that's enough. What is the federal government's plan, though, sir? Like, just let's be clear. What is the threshold for the federal government? Because a lot of these restrictions are provincial, but for you, it's federal. What is the federal government's threshold to begin doing what Quebec, Ontario, Saskatchewan, and Alberta are doing, starting to roll back restrictions because ICU rates are dropping, or, hospitals can handle this? What is the exact threshold? What is the number for the federal government to say, you know what? At this point, we can roll back the PCR test needed at the border. At this point, we will roll back this mandate. What is the threshold? What is a solid number? People are dying to know.
Evan, my other job is the Minister of Tourism. I want to see things open up as soon as possible, but you will know from our work as a federal government that we have held this line of prudence and safety and keeping Canadians safe through the whole time. And I don't know what happened on the Conservative side this morning, but I think they woke up, looked at the papers, looked at the polls, and realized that being on the side of protesters and occupiers no longer floated their boats, no longer was good for them. And now all of a sudden they're saying it's time for people to go home. We've been saying that the whole time. And I can tell you, Evan, in Alberta today, 94% of the beds in Alberta hospitals are full, including ICU beds. I lived through the Alberta summer last year, which was supposed to be the best summer ever, turned out to be the worst summer yet. So we're going to continue to be prudent, and I want this opened up, but we're going to do so when it's safe to do so, and we can have the economy rolling again when it keeps Canadians safe.
Okay, but Mr. Boissonnault, respectfully, sir, people don't want to hear about the politics of who's what. They want to hear the plan. They don't want politics, they want the plan. I'm asking you just a basic question. So Canadians, look, if it's next week, if it's in a month, that's not for me to decide. You're the federal government. What is the threshold number your government needs to see to start removing some of the vaccine rules, restrictions, and mandates? Is it an ICU bed number? Is it an Omicron infective rate number? What is the threshold? So Canadians can say, oh, we've hit this threshold, roll it back. What is it? Does that exist?
Evan, there's no single number that's going to govern this. We're focused on making sure that Canadians stay safe and healthy, that the healthcare system stays healthy. And look, it's a full suite of measures and initiatives that we need to look at. And I want to see the economy open up, but we can only do so safely. And we're going to continue to follow the best public health advice. And as soon as it's safe and we're able to present a safe and responsible plan to Canadians, we will do that. And I can tell you that it is something that I and
what does
colleagues work on
safe mean?
every day.
Okay, I guess I got 10 seconds here. What is, when you say as soon as it's safe, okay, what is the definition of safe? What is the number? What is the definition?
We're going to keep following the best public health guidelines and make sure that when we open the borders and that we get it safe, we don't have to snap back.
Okay. Dr. Theresa Tam has said it's time to rethink some of those border measures. But Associate Finance Minister Randy Boissonnault, I do appreciate you joining us.